There's a number of reasons why a child might need to have their tonsils removed. Probably the most common reason is they're getting frequent recurrent tonsillitis, frequent throat infections. These throat infections last up to a week. They can cause the child to feel quite unwell with temperatures, require quite a number of days off school, and often require antibiotics to settle these symptoms down. It can be quite debilitating for the child, it can be quite disruptive for their general development, and if they're having these episodes frequently enough, then it would justify having their tonsils removed. There's another group of children who have large tonsils and large adenoids, and sometimes these can be large enough to cause problems with breathing, so-called obstructive symptoms. So when they're asleep at night, parents might notice that the child is quite noisy, they snore, but more than that, they might notice they have so-called apneas. So these are periods of about 20 to 30 seconds when the child will seem to stop breathing and then resume, often with a gasp or a sigh. And that can potentially cause long-term health issues, and is normally something we'd look to deal with fairly expediently. And in that situation, you may remove tonsils and adenoids. There's a traditional method for removing tonsils, so-called cold steel dissection, where you use metal instruments to dissect away the tonsillar tissue from the back of the throat, and then you use something called bipolar diathermy or electrocoagulation, which is a way of using a metal instrument with an electric current to generate heat, which then causes blood vessels to seal up and stop bleeding afterwards. The temperatures used by diathermy are quite high and can sometimes cause a degree of trauma to the surrounding tissues, a bit of collateral damage as you were, and then that's what can make the procedure quite uncomfortable afterwards, and that discomfort can be one of the key parts of the recovery afterwards. So with coblation, you're using saline and sodium ions within the saline to disrupt the tissue at a much lower temperature than you would through bipolar diathermy or electrocoagulation. There's very little blood loss intraoperatively, and after the procedure, in my experience, patient recovery is normally quicker and there's less pain and discomfort associated with the procedure as well. So for me, it's my preferred method of removing tonsils in children.